This is a reminder that if you plan on getting Botox anytime soon, that there's a possibility they can hit a nerve and you would be left with the Botox lazy eye.
Oh man, so this patient isn't correct. What happened is the injector didn't hit a nerve, but actually tox spread into a muscle called the levator palpebrae superioris muscle. And this muscle is involved in eyelid elevation. So if you block the function or some of that tox spreads into this muscle, you can't elevate your eyelid and you experience something called ptosis, Ptosis. And this is a rare complication that can happen when injecting neurotoxin in the upper face. So, how did this happen? Well, remember that eyelid muscle is involved. That levator palpebrae superioris muscle is involved in eyelid elevation. So what happened is some of the tox spread into that muscle. Likely multiple reasons. Number one, it could be due to the fact that the reconstitution or spread of effect was a little too high. We have to, as injectors, dilute our neurotoxin in order to inject it into the muscles. This is normal. So when we use the word dilution, it doesn't mean something bad. We have to dilute the product in order to inject it. Sometimes if we dilute it a little too much, its spread of effect is a little too wide, meaning it's too watery, and some of that tox can spread into that levator palpebrae superioris muscle. It could have also been due to injection technique. Maybe it was too close to the orbital rim, that injection poke, or it was too deep, and all of that can contribute to spreading into that muscle. Or number three, maybe the patient accidentally massaged or rubbed their eye and pushed some of that product into that muscle. Either way, it's a watch and wait type of situation. You have to ride out that neurotoxin and let it fade out. I know a colleague that is experiencing an eyelid ptosis as we speak, and she's on about day 20 and is still experiencing some of that eyelid ptosis, but it is getting better and better and better with each day that goes on. Now, there are some treatments that we can offer the patients if this were to happen. Number one, you can offer aproclonidine drops, or also known as Upneek drops, and these Upneek drops target the Mueller's muscle, which helps give you a little bit of temporary eyelid elevation. Now, this is temporary, so you have to consistently use these Upneek drops, but it can help. You can also offer your patient something called pretarsal injections. The pretarsal portion of the orbicularis oculi muscle is a portion that is closest to the lash line. And the function of this pretarsal muscle is involved in a little bit of eyelid closure. So if you can relax this muscle with some additional units of tox, what happens is you can't perform that eyelid closure, so you get a little temporary eyelid elevation. Now, I love referencing this amazing publication. I'm tagging it here. This amazing publication is something that if I were to experience an eyelid ptosis, this is the publication that I would reference. And taking this graphic from this publication, they mark out their pokes for the pretarsal injections lateral to the medial limbus line, because that LPS muscle, or the levator palpebrae superioris muscle, lives medial to those lateral medial limbus lines. So you want to stay lateral to that with your neurotoxin pokes. They do a 3-point injection technique, about 1 to 2 units, depending on how severe the eyelid ptosis. And what it does is it blocks that eyelid closure and you get a little eyelid elevation. Now, with this treatment comes some expected side effects. If you're not able, because remember, we're forcibly opening that eyelid with the pretarsal injections, if you're not able to close the eyelid, you can experience a little bit of dry eye. You have a hard time closing the eye, especially when you're sleeping. So you'll sleep with a little bit of open eye. So what providers can do is prescribe some eye lubrication drops to help moisten the eye, especially while sleeping, or we can tape that eye closed. But it does help take some of that pressure off of the eyelid and helps forcibly open that eyelid. Again, unfortunately, we have to ride out. Typically, it wasn't a full dose that bled into this LPS muscle, but just a few units. So hopefully the result, or this eyelid ptosis, fades rather quickly. But unfortunately, this is a rare complication, but it is a risk that we take when injecting. So ways to avoid this are, I always put my thumb when injecting the corrugator so that it blocks any bleed of that tox into the levator palpebrae superioris muscle, I always stay about 1 centimeter above the orbital rim. And specifically for my lateral injection, my lateral corrugator injection, I stay superficial and I do not go too deep into, remember that lateral corrugator, it inserts into the dermis. So all you need to do is hit that muscle superficially and it relaxes that muscle function. You don't have to go deep. So really understanding your depths of injection will help prevent and keeping that reconstitution tight. At the end of the day, as an injector, all that matters is that you're in control and you're comfortable with your spread of effect. So if you need to tighten that dilution to make sure you don't have an exaggerated spread of effect, then go down to a 1-to-1. Whatever you're comfortable injecting with your reconstitution is what's important. A unit is a unit, right? So trying to prevent this complication from happening versus treating it, but those pretarsal injections or those upneak drops can help, and also performing a little bit of vibration to help metabolize some of that neurotoxin. But I hope this helps understand it wasn't a nerve that the injector hit. It was in fact some spread of tox into that levator palpebrae superioris muscle. But if you're loving these videos, please help me get to 1,000 subscribers by the end of the year. I'm almost there. I'm creeping up, and I love that you guys are enjoying these videos because I love filming them. If you have any requests or anything you've seen in your practice that you'd love for me to expand on, please comment below. I'm happy to take requests. Thanks.